Lassa, a virus lurking in West Africa, rapidly multiplying inside its unwitting vectors, the Mastomys natalensis, better known as multi-mammoth rats.
These big-eyed, soft-eared little creatures aren't all that they seem. These rodents act as hosts for the disease, carrying it around West Africa, transmitting the disease through fecal matter, waiting for an unwitting native to consume them in desperate need of food. This native will walk around, continuing on with their life, until suddenly they begin to feel ill.
The natives now carrying the disease. They have the potential to infect their closest friends and family. The disease can further spread through the bodily fluids of the infected native, making those around them sick.
The native might even die, but at this point it is too late. People who have come into contact with the native are now potentially infected. Once this occurs, the virus has fulfilled its purpose, to multiply and spread anywhere possible, no matter the damage.
Lassa, like Ebola, is a viral hemorrhagic fever. However, Lassa is from a different family and is nowhere near as deadly as Ebola.
As you can see from the map, original cases of Lassa have only been found in West Africa. These countries in blue have reported substantial outbreaks of Lassa, and the countries in green have very few reported cases. There have been several outbreaks of Lassa fever throughout the years.
Lassa was first discovered in Nigeria in 1996. It happened when two missionary nurses died of an unknown virus, later named Lassa, after the town in Nigeria where the nurses died. After the Index 1996 outbreak of Lassa, it didn't pop up again until the 2000s. There were several imported cases of Lassa in Europe. It was in Germany, the Netherlands, and the UK. After this, there weren't any major outbreaks until 2012, once again in Nigeria.
This outbreak infected a traveler who came to the U.S. and died of Lassa on U.S. soil. This U.S. accidental importation of Lassa was fairly recent, as it happened in May of 2015.
The Lassa virus shares a common ancestor that can be traced back more than 1,000 years to present-day Nigeria. The virus spread around Nigeria about 400 years ago, and since then it has moved into Guinea, Liberia, and Sierra Leone.
As it has spread, it has mutated genetically in order to adapt to its mammalian hosts, which is the reason it can infect humans today. Lassa has had no changes in treatment difficulty due to the newness of its discovery. The only reason Lassa is not an out-of-control epidemic today is due to its limited transmission.
The fever is spread through direct contact with an infected person's blood, bodily fluids, or through sexual contact. People living in unhygienic, rodent-infested places have a higher risk of getting Lassa. Consuming or inhaling any contaminated particles of rat excretions will also spread the virus.
Lassa is mainly diagnosed using the rapid ELISA test, which is also used for filovirus diagnoses, such as Ebola and Marburg. The virus's effect on the body begins 1 to 3 weeks after contracting the disease. Patients will have varied effects, making Lassa hard to diagnose. Early symptoms include fevers, cough, headaches, and discomfort. These can progress to more severe and fatal symptoms. Among these effects are swelling, vomiting, diarrhea, mucosal bleeding, and chest pain. Most patients who die of Lassa die of multiple organ failure, caused by internal hemorrhaging.
There are many behaviors that contribute to the spread of Lassa, specifically poor hygiene. Rodent-infested areas are very likely to spread Lassa, and any behavior involving unhygienic medical practices, such as failure to wash hands, reusing needles, or not sterilizing the examination room, can all cause Lassa.
The few efforts that have been made to end Lassa include China's donation of 300 drugs to assist in treating the outbreak, in addition to the CDC's development of a vaccine that has proven to cure non-human primates without causing any side effects. Lassa has very few treatment options, mainly due to its mysterious origins. However, there are 2 drugs that have been proven successful in primates and guinea pigs.
Favipiravir is an investigational antiviral drug that has successfully treated guinea pigs infected with the fatal amount of Lassa virus. Ribavirin is another antiviral drug and has been proven effective in treating Lassa in non-human primates. However, both of these medications have side effects, some of which may include eye irritation, rashes, chest pain, depression, murderous thoughts, fever, uneven heartbeats, bloody excretions, memory loss, hair loss, breathing loss, vision loss, and many other losses. Scientists have started utilizing a technique called next-generation sequencing to analyze the Lassa virus, which allows them to find new treatments and possibly a cure.
Authorities strongly encourage good hygiene and caution all visitors in areas prone to outbreaks. Public health organizations have invested in cleanup efforts in West African countries with many rats. This has slightly reduced the spread of Lassa. However, Lassa is generally difficult to spread, so no laws have been made to prevent it. In addition, many countries, two of which include US and China, have donated medicines and sterilized equipment in order to stop the spread of Lassa through medical hygiene malpractices.
In conclusion, Lassa is an acute viral illness that originated in West Africa. It is not dangerous, even left untreated. The transmission is highly limited, and only 1% of people who contract Lassa will die from it. New medications are being discovered every day, and soon in the future, Lassa will not be a threat to anybody, no matter the country.